First of all is to believe in their competency and their intelligence, that even if they don't have a communication system, they absolutely understand everything that you're telling them, and watch their cues, their gestures, and speak to them as they are age appropriate, and always respect if they tell you or turn their head away to say, I don't want that. Respect that that's what they're telling you. If it's not the conventional way, which most of our girls and our children adult with Rett syndrome cannot speak. So, and if they have a talking device, always respect that that was the choice that they wanted. And so that would be number one, is respect. Yes. And definitely, if you're going to work with that individual, become knowledgeable and educated. If it means trying to get into speech pathologists, augmentative centers, or the parents teach you and train you, it will make your job far more valuable, and it'll be more worthwhile. And it's vital to be able to understand all the methods of communication, of gestures, of their eyes, if they use a complicated device like the Toby, or if they use picture symbols. To work with the family, and you have to respect the family's values and where they are, because people who work in this field may believe differently than what the family does, but there's a lot of reasons why the family has gotten to the decisions that they have, and it's one, unless you live it, you don't understand it. If a family decides to keep their loved one, in this case it would be their adult child at home, and the caregiver has worked in the group home setting all their life and believe in it, but the family chooses a different direction, is to come with an open mind. And the other part would be as if they lived at home, but for whatever reason the family member, and it's heartbreaking, has to make a decision of residential care or going to live with someone else. Know that that decision is not made lightly, and it's heart-wrenching. And often, as we've aged with our daughters, we've learned how to internal our thinking, and we don't share everything unless we trust you, those personal decisions. And so to know that there's a lot more to the story than what's being presented in front of you.